All right, let's jump right in. If you're a professional in the autism field, you know the landscape is just flooded with information and misinformation. So, how do you cut through all that noise? How do you really know which interventions are backed by solid, rigorous science? Well, that's exactly what we're going to tackle today. We're going to build a sophisticated, actionable framework for making those critical evaluations. So, here's our game plan. We'll kick things off with the absolute gold standard: evidence-based interventions. Then, we'll unpack the hierarchy of evidence, which is crucial for weighing claims. After that, we're going to get practical, applying evaluation frameworks and learning how to spot the red flags. And we'll wrap up by giving you a toolkit of resources you can start using in your practice tomorrow.
Okay, so let's lay the groundwork. We have to start with the absolute foundation of everything we do in modern practice, and that's the concept of evidence-based interventions, or EBIs. And let's be crystal clear, this isn't just a best practice. It is the non-negotiable standard of care. So what exactly is an EBI? It's so much more than just the research. The best way to think about it is like a three-legged stool. The first leg, of course, is the best available scientific evidence. But that alone isn't enough. The second leg is your clinical expertise, your judgment, your experience. And the third, equally important leg, is the client's values and preferences. It's the synthesis of all three that truly creates effective, personalized care. You know, this whole approach didn't just appear out of thin air. It really started gaining steam back in the 90s with this big push to base clinical decisions on the strongest evidence available. Fast forward to the 2000s, and we see systematic reviews and meta-analyses become the new benchmark. And today, we're in this incredible era where digital tools and even AI are helping us analyze evidence faster and more effectively than ever before. So that brings us to the core organizing principle for how we evaluate all these claims: the hierarchy of evidence. The best way to think about this is like a pyramid. It's a framework we use to rank evidence so we know exactly how much weight to give different types of studies. Down at the very bottom of the pyramid, you've got things like expert opinions and individual case studies. Now, they can be valuable for generating new ideas, but they're highly susceptible to bias. Moving up a level, you have observational studies, which can show us interesting associations. But the game really changes when we get to randomized controlled trials, or RCTs. These are our gold standard for establishing causality. And what's even more powerful than one RCT? A systematic review that synthesizes the findings from multiple high-quality RCTs. At the very peak, you have clinical practice guidelines, which take all that robust evidence and translate it into actionable professional recommendations. This really all boils down to one crucial distinction: empirical versus anecdotal evidence. Empirical evidence, that's what our pyramid is built on. It's systematic, it's controlled, and it's replicable. It's designed for objectivity. On the other hand, you have anecdotal evidence, the powerful personal stories. And look, those can be compelling, but for us as professionals, they're just not reliable. They're inherently subjective and have very limited generalizability. You simply can't build a sound clinical practice on them. Okay, enough theory. Let's get practical. We've got the framework, now let's talk about the actual toolkit. How do you apply this stuff in your day-to-day work when you're evaluating a potential intervention? Two of the most robust systems you'll run into are called grade and sign. They both help us grade evidence, but they look at it from slightly different angles. Think of grade as assessing the big picture, the overall quality of the evidence, and that critical balance of benefits versus risks. It gives you a strong or weak recommendation. Sign, on the other hand, is a bit more of a microscope. It really zeroes in on the methodological rigor of the studies themselves. Understanding both gives you a powerful toolkit for assessment. So that's great in theory, but what does it actually look like when a brochure for a new therapy lands on your desk? How do you put this into action right then and there? This is basically your mental checklist, your first line of defense. You need to be asking, what's the real strength of the evidence here? Are we talking a meta-analysis or just a single case study? Has this been replicated across diverse populations? Is the effect size clinically relevant or just statistically significant? Is it actually generalizable to my clients? And a huge one, are there any potential conflicts of interest here? And finally, what do reputable health authorities say about it? Okay, so we've covered what good evidence looks like. Now, let's flip that coin. It's just as crucial to be able to spot the warning signs, the hallmarks of pseudoscience and interventions that are just not effective. This is maybe the biggest, brightest red flag you'll ever see. Anytime you hear the words miracle cure for autism, your alarm bells should be screaming. We know autism is a lifelong neurodevelopmental condition. Interventions can be life-changing, but any claim of a cure is a massive indicator of pseudoscience and requires extreme skepticism.
And here's another one, the claim that one single treatment works for everyone. Really? Given the incredible heterogeneity of the autism spectrum, the idea that a one-size-fits-all solution exists just flies in the face of everything we know about individualized care. It's a serious warning sign. And we have to be really clear about why this all matters so much. The stakes are incredibly high. Using non-evidence-based interventions can lead to huge financial losses for families, delay access to care that actually works, and in some cases, cause direct physical harm. Beyond that, it erodes trust in legitimate science and our entire field.
So, how do we stay vigilant? How do we keep up when the research is constantly changing? This last section is all about empowering your practice with the tools you need for a career-long commitment to staying current.
These should be the go-to bookmarks in your web browser. Seriously, if you want the absolute highest quality systematic reviews, you go to the Cochrane Library. Full stop. For broad searches across biomedical literature, PubMed is your best friend. And to see how all this evidence gets turned into actionable guidelines, check out organizations like SIGN, NICE, and AHRQ. These are your primary sources. And the best part is, you don't have to go digging for this stuff every week. You can make the research come to you. Set up search alerts in these databases for specific topics. Use an RSS reader to follow key journals. You can even activate citation alerts for seminal papers. Let technology do the heavy lifting for you.
And finally, here's a pro tip. Use academic social networks. Platforms like ResearchGate and academia.edu are fantastic because you can connect directly with the researchers doing the work. You can follow specialists, track topics, and often get access to preprints of studies before they're even officially published. It's a great way to stay on the cutting edge.
So I'll leave you with this thought to reflect on. In an era that is just swimming in misinformation, what is our collective professional responsibility? We are the gatekeepers. We have the training and, frankly, the ethical obligation to critically evaluate information and guide individuals and their families toward interventions that are safe, effective, and grounded in science. Upholding that standard is our most fundamental responsibility.